Good Tuesday morning. How is everyone doing today? Happy Tuesday. This is Jenny Gallagher with Joyful Heart Healthcare. We're going to talk hypertension today. I did not get a chance to post an announcement or update the information about our topic today. It's been a busy week, so I apologize for that. But most of you have your notification set to get alerts when we go live. So folks will be joining us shortly and we'll dive in. So happy Tuesday. I just refilled my coffee. I already finished one. So it's not full, just a little bit, so we can chat. Good morning, Sherry. Good morning, Mariah. Good morning. People are joining us. So how is everybody doing today? We're going to talk about blood pressure, hypertension today. Good morning, Judy. So we have lots of people joining us. Good morning, Renee. Good to see you. We're so glad to have all of you joining. Hey, Tiffany. Yes, Renee, it is an absolutely gorgeous day. It's what I call perfect weather. I wish it could be like this year round, but then we would sacrifice all of our seasons. Like, you know, the mercies are new every morning, right? Good morning, Joanne. Glad to see everybody hopping on. Numbers are climbing. Good morning, Sandy from Indiana. Hi, Diane. So I am excited to chat with y'all today. I was looking over the last couple weeks. I've kind of racked my brain for new ideas because I've talked about so many things. And like last week was a review because as I looked through some of the topics and skimmed through some of the video, I thought, well, we need to talk about water again. So if you're looking for us to talk about a topic in specific, just let me know. Shoot me a private message or an email or a text to let me know what you're talking about, what you want us to talk about. But as I looked through last week, looking for new ideas, I thought, I've never talked about blood pressure. How could I not talk about blood pressure? It's like one of the most commonly treated diagnoses on the planet today. I don't know how I missed that, y'all. I'm negligent, I guess. So forgive me. But we are going to talk about blood pressure today. And hopefully y'all will learn a thing or two and take better care of yourselves because of something I might offer y'all. So, or maybe your husband or your parent, somebody will benefit from something we talk about, I hope. So, what is hypertension? So hypertension, the diagnosis from mainstream medicine is basically any blood pressure reading above 140 over 80 or 90. It depends on which reference you use. The newer guidelines call hypertension 130 over 80 or higher, even though we don't really medicate until about 150 over 90. There's that little gap of numbers that falls into what mainstream medicine likes to refer to as a pre-hypertension. It means it's happening. And for mainstream medicine, they say it's always progressive, that if you have pre-hypertension, you're always going to progress to hypertension at some point. But that's not always true if you do some things about it. So what exactly is blood pressure? Like, just because hypertension is a definition with numbers, what is a blood pressure? So blood pressure is the force with which the heart pushes blood through your artery. So that pressure is measured with a sphygmomanometer. Say that 3 times real fast. Blood pressure cuff is the easy word. So when we measure, what happens is when we measure blood pressure, that cuff tightens down. It literally shuts off blood flow to your arm and fingers for a minute, not long, like 30 seconds, 40 seconds, while we're listening for the thumps in the artery pulse. So as the blood pressure returns, it's at a really high force. And so that high force is the top number. The first number we hear with our ears, with a stethoscope, listening to your blood pressure, or if you're using a digital thermometer, the first beat the device senses, feels, is your top number. So it might be 132 over something. Okay, so the top number comes from the first pulse that returns blood flow to the arm that's heard. Okay, that may not be the first pulse that happens, but it's the first that's heard. Okay. The bottom number is what happens after all that returns back to normal and you have a relaxed set of pressure pushing on the arteries. That's what we call your heart work at, your heart work at rest. And so what that means is we have really high pressure at first, and then less as we listen, and that dial begins to fall. Okay, so top number is the highest pressure or the hardest work of the heart, and the bottom number is your heart at the least amount of pressure on the arteries, or your heart work at rest. Okay, does that make sense? Any questions about any of that? Good morning, Barb. Hey, Alyssa. Glad to see you here this morning. Hey, Marianne. I'm not sure I saw everybody say hello, so I apologize if I miss you, but sometimes it goes by really fast while I'm talking and I miss people. So I'm sorry if so, but that's basically how blood pressure works. So if you are diagnosed with hypertension, that means your heart is overworking. Okay? We don't want your heart to overwork. What are some things that cause the heart to overwork? Well, one is simply just weighing too much. So if we are overweight, then the heart is having to beat blood to blood vessels, capillaries, and body parts, fatty tissue that did not really belong there. Okay, so that's one of the reasons why hypertension is so common, because it's estimated that 90% of Americans are overweight or obese or pre-diabetic or diabetic or hypertensive. So all of those markers contribute to more stress on the heart. How does that work? Well, let's think about diabetes, for example. Diabetes and hypertension often go hand in hand. They're diagnosed a lot together. And the reason is diabetes causes elevated glucose. That's blood sugar. So if your blood sugar is high, that means your blood is thick and sticky, more like syrup than water. We want watery blood flow, not syrupy blood flow. Okay, so if you have elevated glucose numbers, then your heart is having to push harder. That pump is having to push harder to move thick, sticky blood through those vessels rather than pushing water through those vessels. Think about that pumping kind of action for a moment and just ponder that a little bit, and it will start to make much better sense for you. Think about water running off of a mountain down into a brook. If you have a mountain with water running down the sides, gravity pulls it real easily. However, if you think of a glacier-laden mountain, water moves much more slowly down that mountain because of all of the ice. It's thick, it's harder to move the liquid through because it's frozen, okay? So that's kind of the same analogy if you kind of think about that. One of the analogies I put in my writings is often thinking about a beaver dam. If you look up images of beaver dams on internet searches, you'll find that a beaver dam is like lots of sticks and branches and clutter piled up by beavers in a body of water, a river, and they literally block water flow. And so the same kind of thing happens in the bloodstream when we have diabetes. High sugars make thick, sticky, syrupy blood. Therefore, our heart, has to pump harder and sometimes even faster to be able to make that sticky blood, syrupy blood, move through the arteries to deliver oxygen. Okay, so diabetes is one reason that people develop hypertension. Another problem that happens is insulin resistance. If you have high insulin, you may not have thick, sticky blood, but you have inflamed blood. So insulin that gets above 7 or 8 is really detrimental to the heart and to blood vessels because it triggers a lot of hormone imbalances, a lot of chemistry imbalances, a lot of inflammation. Okay, so insulin drives inflammation. So it's really important if you have high insulin levels that you address that as soon as you can because high insulin is going to turn into pushing inflammation all around. And the worst place we want to find inflammation is in the blood flow of the heart. If blood flow in the heart becomes impaired because of diabetes or inflammation, then blood flow does not move smoothly through like water. It begins to get thick and sticky. Okay. Blood clots form easily in the presence of diabetes, high glucose, and or high insulin resistance, because those arteries become like thick, traffic-laden highways. So imagine, think back to the past few winters. We've had a couple of massive congested highways, like Atlanta a few years ago, caught in terrible snowstorm, and the city is not prepared for that kind of snow, and traffic was backed up for miles and miles and miles for hours and hours. And so that kind of the traffic would move, but very, very slowly. And so when you have blood flow that's thick and sticky and inflamed, it's not moving through as normally as it should. It's not moving at 55 or 70 miles an hour. It's moving at 30 miles an hour. If you slow blood flow down like that because it's just thick and it's not moving, that puts pressure on the heart, which is way back here, upwind, upstream of the blood flow. And so you have to address those thick, sticky inflammation issues. Otherwise, it's going to contribute to heart disease. You're going to have clots that form, especially if you think about a highway and its arteries. It's V's, it's Y's. As you come up on various forks in the road, you have blood vessels exactly like that. And so if you have a big artery, there's much less likelihood of a clot in the big artery, but that big artery is going to divide off. It's going to Y off multiple times into smaller and smaller roads for that blood flow to travel. And if you have any kind of thick, sticky, inflamed blood, the clot is going to form at some of those junctions, in some of those places where there may be slightly rougher terrain, maybe a dirt road, so to speak. And so that's difficult. You can't drive 80 miles an hour down a dirt road without consequences, right? And so the same thing happens in your blood flow system, in the arteries and blood vessels. And so that impairs good oxygen delivery. Remember, the main job of the heart is to deliver oxygen to your body's cells. If your oxygen is not getting to your cells, you're going to have issues and symptoms, mostly that start with fatigue. You're just going to tire easily. You're going to have more shortness of breath. Lots of things are going to spiral out of control when the heart is unable to deliver oxygen properly. And so all of that pressure then backs up on the heart. And so now, because of this clot or this thicker blood downstream, down the road in these little bitty arteries, Blood is just not moving at the right speed, at the right velocity. And so the pressure set, the heart says, I wonder what's going on down there. That leg muscle is not getting enough oxygen, so I'm going to pump a little harder. And so the pump begins to work harder and harder, trying to force oxygen to that body part. If it's your brain, if it's your leg, it's your eye, it doesn't matter which organ or body part. If the oxygen can't get there, then waste can't be picked up. Remember, that's also our garbage truck. When the oxygen gets delivered, the blood vessel picks up carbon dioxide, which brings it back to your lungs, and you breathe that out. That's waste that you're getting rid of. That's the garbage truck. Okay? So all of this is combined into this one thing, the beat of the heart, to help deliver proper oxygen to the body parts. And if the body can't get oxygen, then the heart starts doing things to make up. It starts compensating. Okay? And so it's really vital that we understand some anatomy and physiology to make sure we are handling our health the best way we can. So if you have diabetes or insulin resistance or history of blood clots, or you're likely to have, you have a high propensity for blood clots. If you've had a blood clot in your leg, that makes you at higher risk for other blood clots in the future. All of that is driven mostly by inflammation and glucose. And so we want to get rid of inflammation and glucose, because those are the two big things that drive all of our chronic disease today. Okay. Another thing that will impact the force of the heart, the work of the heart, is a high triglyceride level. Remember that triglycerides come from the carbs we overconsume, and is part of the 3 processes that the body uses to lower blood glucose. So the body says, oh, well, I'll take this glucose out, but we're going to shunt it over here to the liver, and the liver can knit together all these triglycerides for you. Okay. So that's good, right? Well, yes, as long as those are in small amounts, because triglycerides in large amounts end up making the blood thicker and stickier all over again. So then we're back to square one. We have thick, sticky blood that's not able to move through, and that raises inflammation, and it raises the force of the heart. So that raises blood pressure. Okay. Another thing that will contribute to high blood pressure is a very low HDL. How is that possible? Well, remember that HDL is what mainstream medicine calls the good cholesterol. There is no such thing as really good or bad cholesterol. HDL and LDL are just basically trucks. They're delivery mechanisms. They deliver fatty acids to and from the body cells, the organs that need them. Okay, so there really isn't a good cholesterol. But HDL that's really low, like under about 40, 45, really is unhealthy, because there's HDL works specifically to help remove some of the fatty acids. And so we want a high HDL for that purpose. Mainstream medicine calls it the good cholesterol because it's been shown in multiple studies over multiple years to be beneficial for heart health to have high HDL. That said, the calculations we use to calculate LDL are skewed when you have HDL over about 50. So while the even mainstream says you want a HDL really high in the 50s or 60s, once it goes there, they lose all consciousness, all logical reasoning, because that pushes your total cholesterol higher and higher. Therefore, they panic and they say, oh my God, your total cholesterol is so high. Then they totally forget to look, well, it's the HDL that's pushing it high. That's not a problem. That's not a problem. The HDL that goes high is really beneficial, but it skews the calculations we use to calculate total and LDL. So when your HDL is high, you pretty much have to completely ignore total cholesterol numbers and LDL numbers because they're just not going to be accurate. It's just not right. I don't know how they decided this calculation worked, but somebody needs to go back and make a new calculation because it doesn't really work in the whole scheme of things. And in functional care, more of what I do, we typically only look at triglycerides and HDL because we know those are the two most important numbers to watch. Ideal triglyceride level is less than 100. Mainstream says less than 150 is fine. But what we find in more functional care is when that triglyceride level is 100-ish or higher, there's more inflammation, there's more trouble with insulin, there's more trouble with weight. Like lots of things are driven by that triglyceride being even just a little bit too high. So if your triglyceride is above 100, how do you fix that? Is a statin going to fix that? No, statins never address triglycerides more than about 5 points, 10 points. So you don't want to use a statin for a high triglyceride. Some providers, even functional providers, will use a statin with really, really high triglycerides, like over 300 or 400, because we know statins do reduce inflammation some, and that's the big problem. If you have high triglycerides and high inflammation, boom, we're waiting on a heart attack or a stroke. And so some functional and almost all mainstream prescribers will put those people on a statin, at least temporarily, to get that triglyceride level down. What I find is that statins usually cause more brain issue, more cognitive dysfunction, forgetfulness, loss of words, not being able to think through a whole sentence clearly, or they chase ideas. We call it flight of ideas in healthcare or mental health care because you just jump around from place to place and you can't really land on a focused moment. But statins do contribute to brain dysfunction like that. And so the other thing is statins will actually raise glucose. If you haven't looked at the side effects of your medicine lately, check out rxlist.com or drugs.com and look up the side effects to all your medicine. You may find that your medicine might be causing or worsening some of your symptoms. Okay. Questions. I've talked really fast this morning. I don't know why. Maybe I'm not needing the second bit of coffee I started on. Questions, comments. What are your thoughts this morning? I can talk for hours, y'all, although I don't have time to talk for hours about your health. But questions any of you have? I've seen a bunch more people join in since we started. So welcome. I'm glad you're here. I didn't get to say hello to everybody, but I'm glad you're here. But questions, anything about blood pressure before we finish up here? I have a few more things to talk about. Okay, I don't see any questions popping up. So blood pressure is one of the things that is a marker for metabolic dysfunction. Some of you have followed me a long time and you know that term. You recognize metabolic dysfunction as a term I use a lot. It's a huge umbrella term for lots of chemical imbalance, lots of problems in the body. Mainstream medicine calls metabolic syndrome or syndrome X the same kind of thing. They use a specific set of criteria and they say if you have 3 or more of these specific things, you have metabolic syndrome or metabolic dysfunction. Okay, I have a much longer list. We're going to talk about the differences. So mainstream says if you have a large waistline and or high blood pressure and or high glucose levels, sugar levels, and or high triglycerides, and or low HDL. if you have any 3 of those markers, you have metabolic syndrome. Okay? All of my patients fit there. All of mine. Something out of those 3, out of those 1, 2, 3, 4, 5, usually most people have. I add, if you have high insulin levels, that's 7 or greater is considered high. Up to about 22, 24, 25 can be considered normal insulin. However, those of us in functional care realize and recognize that an insulin level of 10 is abnormal and pushing chemicals out of balance. And so I include an insulin level, high blood pressure, high glucose, high triglycerides, low HDL, a large waistline, and high insulin. If you have any 3 of these, you have metabolic syndrome, you have metabolic dysfunction. So it's important that you know your markers. Sometimes I post a graphic, especially in February, which is Heart Month. I posted a few times other than that, but it's real common for me to post it in February. But it's just know your numbers. So know your waistline. For women, a waistline greater than 35 inches. For men, it's a waistline greater than 40 inches. Both of those have been associated with more chronic disease, cardiovascular disease, hardening of the arteries, heart attacks, and strokes. So know your numbers. What is your waistline? If you're a female and your waistline is larger than 35 inches, it's time to get to work. Okay. If your waistline, if you're a male, is greater than 40 inches, it's time to get to work. Remember that insulin's job, its main job, is to store fat by removing glucose from the bloodstream. Okay. So insulin's only job is to store fat. If you continue to push insulin levels higher by the carb intake, your only result is going to be more weight gain. Okay? So it's really important that we understand the physiology, we understand the chemicals, we understand more than just, oh, you have diabetes, you have high triglycerides, you have hypertension. Like, just getting a diagnosis from a prescriber doesn't really tell you the anatomy, the physiology, the chemistry that's going on inside. Some of you are saying, dang, I didn't pay attention in chemistries. I don't get it. That's okay. That's what I'm here for. Go back and watch my videos. Read my articles on my blog. My blog is at the website joyfulhearthousecalls.com. So you can just type in joyfulhearthousecalls.com. You can read all of the articles that are published on my website. I recently wrote several new articles that are coming out. I'm so behind on writing blogs because I see patients all the time. But I actually wrote a few short ones and have scheduled them to pop up on Mondays for the next few weeks. I'm trying to get in the habit of having that post every Monday. And so if it hasn't posted by Monday, then Tuesday I'll go through and manually push it through. It's a new experiment I'm trying with my website to see if it actually schedules properly. But I'm hoping that that works well. But when it hasn't, if it didn't work properly through the website, then on Tuesday mornings after my video chats with y'all, I'm going to go through and manually push that through. Julie, it is joyfulhearthousecalls.com. But yes, I can add it to the comments when we're done. What is too low for blood pressure? There really isn't a low blood pressure that's unhealthy unless it's causing symptoms. What are those? If you are dizzy and lightheaded, especially if you're starting to have positional change dizziness or lightheadedness, that can be a sign that your blood pressure is too low. If you're on medicine, it's most dangerous. But if you're on zero medicine for blood pressure, there really isn't a too low for blood pressure. I remember when I was in my RN bachelor's school training, one of the first skills we had to learn was to check vital signs, and we all took turns being in the hospital bed in our lab practice. And it was about 4 or 5 of us in a group, and we'd put somebody in the bed, and 2 of us would practice on each arm on either side. And so it came my turn to get in the bed, and I had 2 people on my sides checking my blood pressure simultaneously. And both of them listened, and they got done, and they looked at each other across me and said, "I didn't hear anything." And so I'm sitting there wondering, I don't have a blood pressure. I don't know what's wrong with me. And so they said, well, let's just do it again. So they did it again. And I still had no blood pressure that they heard. I had a blood pressure. I assure you, I was not dead. So they did that a couple of times to go back through there. And then they finally called our lab instructor over and said, "Miss Moreno, we don't hear a blood pressure. What are we doing wrong?" So she listened, and she got done, and she said, "Oh, there's a blood pressure. You're just going to have to listen a long, long time." They were giving up before they got to my blood pressure. My typical blood pressure has run like 90/50 since I was a young person, like way back. Most nurses that would check my blood pressure in clinics would give up. Sometimes the digital monitors would error out because it gave up because my blood pressure was so low. And so over the years, that problem sort of went away. I was a little healthier, a little more active back in the day. And so now I have a more normal 130/80, 120/70 blood pressure now. Yeah, they were just giving up too early. And so low blood pressure isn't a problem unless you're on medicine that may be lowering it. And it doesn't always have to be blood pressure medicine. I said blood pressure medicine, but other medicines will lower blood pressure too as a side effect. That's why I encourage you, if you're on any prescription drug or over-the-counter drug, you always go and look up your side effects. You need to know exactly what those side effects are, because if you start having symptoms after you start a medicine and then you go to a prescriber, they're going to put you on another medicine. And then you're going to have more side effects from the new medicine or the combination of medicines. And they're going to put you on a new medicine. And it just spirals out of control. And so if you know the side effects of whatever you're prescribed, you'll be more aware. Okay? So how do we treat hypertension? All of that kind of roundabout takes us back to our blood pressure. So hypertension is treated by mainstream medicine with antihypertensives. There are a few classes of those drugs. The most commonly prescribed drugs are things like lisinopril or enalapril. Those words that end in RIL, pril, those are called ACE inhibitors. Those work in the kidneys to alter what enzymes are impacting water balance. They're not a diuretic, but they work in the kidneys to stop ACE from being secreted back in the bloodstream. ACE is acetyl don't ask me, it's a long word, ACE inhibitor. It's acetylcholine esterase. So the other commonly prescribed drug is an ARB. It's a different kind of blood pressure medicine than the ACE inhibitors, but it's similar in action. It just works a little further down in the process. And so it does not alter diuresis or influence fluid balance insignificant, but it alters some of the enzymatic pathways to fluid balance. And that's how it controls blood pressure, because mainstream medicine thinks it's a water issue and a salt issue, but it's not. But those are 2 commonly prescribed drugs. The big problem with ACE inhibitors is a cough. The big problem with ACE inhibitors and ARBs is angioedema, which is a very big puffiness, swelling of your face or other organs. It's dangerous if it's your face and mouth because of the airway that is being jeopardized. So if you have swelling because of an ACE or an ARB, you need to let your prescriber know, and they usually tell you to stop that drug immediately. Depending on how bad the swelling is, you may be hospitalized because it's that significant sometimes. But if you wake up one morning and your lip is a little puffy, time to see about that medicine, because that's not good. You do not want that swelling happening, because if it's happening here, it is easily happening down the rest of your airway system. Okay, so ACEs and ARBs, be really careful using them. Another commonly used class of drugs for hypertension includes calcium channel blockers, things like diltiazem, amlodipine. Those are two different types of calcium channel blockers. They work on moving calcium around, because we know electrolytes do impact water balance. So if we can move calcium around, that influences your sodium, your potassium, your magnesium, your chloride. So moving calcium around, calcium channel blocker, means that calcium is not taken up by cells. More calcium stays in the bloodstream. Therefore, it alters your electrolyte balance. And so moving calcium around can influence blood pressure. And so we use those drugs sometimes as well. I mentioned already diuretics. That class includes several drugs like Bumex or Lasix, hydrochlorothiazide. Spironolactone is a commonly used diuretic. So those drugs are all intended to move water out, because the theory is if we reduce the amount of water, then the heart is going to have to push less hard. And so we remove the water. So sometimes that is true. Sometimes that is a benefit to move that excess water out. But it's most helpful, especially in patients with congestive heart failure, because what's happening in their heart is because of probably other conditions. You don't just magically get CHF one day unless there's a reason. And so CHF usually builds up over time because of poorly managed other conditions, the most common of which is poorly managed hypertension. So if your heart's working harder and harder and harder, it doesn't get bigger and buffer like your skeletal muscles do. If you go to the gym and work out and you get hard, you work out hard and you do weights, you're going to get big, strong, fat muscles. Just look at the athletes that work out. Look at the big muscles that they have. That does not happen when the heart works harder, okay? The heart that works harder gets fat and weak, not fat and strong. So the fat in that case is extra fluid building up inside the muscle cell itself. The muscles are just getting more and more inflamed, and so they begin to swell until the heart muscle is so impacted that the muscle fibers are weak, and so they don't push blood through healthy and normally. And so that creates a backflow of fluid. So then fluid starts to build up in hands and feet. And so if you have swelling, that's a real sign that we need to assess what's going on systemically. How is your body working otherwise? It's not about your feet. It's about circulation most of the time. And so you want to investigate that. You want to see your prescriber and have your blood pressure monitored, have your heart checked with maybe an echocardiogram. Look at the actual structure of your heart. If you're worried about cholesterol, another test you hear me talk about sometimes is the CAC scan, the coronary artery calcium scan. That specific test can tell you about blood vessels in your heart. It's not going to really tell you about size like congestive heart failure, but the echocardiogram will tell you about the size and structure of your heart. So those are the main classes of blood pressure medicines. There are a couple of others that we use more sparingly, like the nitrates. Those typically are for what we call severe and blood pressure that's just not responding, poor responding to the medicine. So there are some other classes, but they're not used as often, and often we start them in the hospital or under close observation, outpatient. So how do we treat hypertension in more functional practice? Well, we address the root cause. We find out what all those markers are. We look at your waistline, we look at your blood pressure, we look at your sugar, your triglycerides, your HDL, and your insulin. And so then we start working on those specific things. Usually it's with a low carb eating plan, because if we cut the carbs, we reduce the glucose, which in turn reduces insulin, which in turn reduces inflammation. So we get rid of the grains and we get rid of the carbs, we lower that glucose, and that almost always will drop blood pressure. A few times it does not. Then we have to look for other contributors. Is there a stressor? Are you not sleeping well? If you do not sleep well, you will have eventual health impacts from that. So it's extremely important that you figure out ways to improve your sleep hygiene. We have a whole video on sleep, so go back and watch that if you need that. But you want to address sleep hygiene and make sure you're not using the PM drugs to help you sleep. Those are going to raise blood pressure, and so you never want to use those unless it's like once a year. More than that, and you need to address sleep. Okay. What are the stressors? What is sleep like? What is mood like? What is energy function in the day like? What are your estrogen, testosterone levels? All of that plays a role in your blood pressure getting under better control. So how we treat hypertension in functional care is quite a bit different. Yes, sometimes even in functional care, we do prescribe drugs. Usually I call it a bridge, like it's a bridge to get you from where you are to where we need you to be, okay? So it might be that we use a medicine for your hypertension for 3 months, 6 months, 2 years, who knows? But while you're working on getting the insulin under control, fixing the anemia, fixing the estrogen, testosterone, the vitamin D, all of those things impact your blood pressure. And so it's really important that you pay attention to all of those chemicals, because if you're missing one of them, you're not fixing the hypertension or the insulin resistance. Okay. All right. I hope that helps. Y'all have been really quiet today. No questions, really. Yeah, I don't have anything else for y'all today. Other than I'm going to remind you of my blog. I am posting new articles. Let me see if the one from yesterday posted while we're here. Let me find my address. Here it is, right in my favorites. Yes. My new article posted yesterday. It is called Salt is Essential for Good Health. So how timely. We're talking about blood pressure, and I write an article about salt. So go check that out. I've also created a new salt video that I posted on YouTube last week. It is how to get the salt in. So a year or so ago, I posted a video about salt's history and how it's really not unhealthy for us. But several people, lots of my patients, other followers have messaged me, other prescribers even, how do you get that salt in? So I did a short video. It's like, I don't know, 5 minutes, 7 minutes long. It's not long at all, but it's on my YouTube channel, and it's just my name, Jenny Gallagher. But on my YouTube channel, there is a video about how to get the salt in. It literally just talks you through measuring it out and making sure you're getting that bare minimum 2 teaspoons. That's it. So salt is essential for good health. New article on my blog. Go there, read that, and then post it and share it all over social media. Post it, share it on any place you can share it, because people think salt is so bad for our health. All right, now we have a couple questions. Marianne and Wanda both want to know about blood pressure in doctor's office. It's stressors. Okay. So Marianne's question is more about blood pressure. Wanda's is more about cholesterol. So I'll address both of those. Marianne, it's stress. The top number goes up when we're stressed. And so a lot of times you'll show up at the doctor's office. Number one, you've been rushing. You've been afraid you've been late. Once you get there, you sit there for who knows how long because they're behind. And so therefore they push you behind. And the longer you sit there, the angrier you get or the more frustrated you get or the more you're thinking, oh my God, I have to get here. I have to do this. I'm thinking, my mind's all scattered about all the things. That raises your blood pressure. So when the nurse calls you back and then sits you down, number one, you've just walked 100 feet or so. That activity raises your blood pressure, even if it's a little. But your anger, your stress, your feelings, whatever was going on before they called you back has now pushed that blood pressure up. So then you might see a blood pressure reading like 156/82. And so then they're like, oh, your blood pressure's high. No, it's really not. Always take your own home blood pressure readings with you to the office. Knowledgeable, smart, savvy providers, doctors and nurse practitioners and PAs will realize that an office blood pressure reading is very inaccurate. If you take your home readings from when you're resting and not working and stressing and trying to get to appointments and waiting and frustrated because you've been there an hour and a half, take your readings. Take it with you on an app or on a written down piece of paper, in your phone notes, take whatever. But share those numbers. When they say your blood pressure's a little up this morning, do you think it's from the stress of getting to your appointment? Yes, sir, I sure do. Yes, ma'am, I sure do. Here are the readings I've been getting the last couple of weeks at home. And then you have 112/65. You have 120/72. Like you have all the healthy readings from home. The savvy prescriber will document what your home readings look like, and they will completely discount the stressful reading. We know blood pressure never stays the same. If your blood pressure stayed the same all the time, you'd be dead. Okay? It's always changing, moment by moment. Okay? What we don't want is to not catch a blood pressure that's staying high. Therefore, your readings from home will give the provider much more data than a snapshot in time of the one office number. Good question. Wanda says, yes, there is something you can do about cholesterol. One of the things, the most common thing, the most trustworthy thing is to make a bargain with them. If they want to check your cholesterol, number one, just say, I don't want it checked. You can refuse the test. That's the first step. The second is if you've already had the test or they sort of insist, they order it really, and you just don't know they're going to run it, then you want to maybe make a bargain that says, how about, doc, we get the coronary artery calcium scan instead of the cholesterol or instead of the statin. If it comes back, then we'll have this conversation again. Okay? Make a bargain with them. Deal with them. Because many of them are becoming more and more aware of the CAC scan and its influence and information regarding heart health. So if you get a coronary artery score that is, 600, 800, then you know you have calcification in your arteries that are supposed to be providing blood and oxygen to your heart muscle, and that's not a good number. Okay? So you want to address that. But if your calcium score is less than 100, the lower the better, then you have no real concerns about calcification or cholesterol. Okay, good question, Wanda. And yes, coughing from lisinopril will cause stress and raise your blood pressure. That's why we don't recommend you continue using it. You notify your prescriber and say, I can't get rid of this cough. I tried lisinopril myself for a while. I was having a really stressful period of time and my blood pressure was climbing, so I tried it for a while and I could take it just fine until my allergies flared up. And once my allergies flared up, I never got rid of that ACE cough. it never went away. So I wound up just stopping it completely, addressed my stress, and I was like, yeah, we just gonna do without that. So yes, coughing will be enough to raise your blood pressure. So if you have a cough that is likely contributed to by the ACE or the ARB, you want to talk that over with your prescriber and get another medicine to address that. Good question. Okay, good questions. Just when I thought I was going to end. Oh, another good question, Wanda. The best time of day to check my blood pressure. Doctor says first thing in the morning. That's actually the worst time of day. Upon awakening, your heart is signaled to wake up and to fund the body with better oxygen. All night long, your heart rate has been nice and slow. If you've got a Apple Watch that you sleep with, or a finger device that you sometimes monitor your heart rate overnight with, like if you have any of these little electronic devices, you can measure your heart rate overnight and your blood pressure. So if you are checking your blood pressure first thing in the morning or within the first couple hours, you might see higher blood pressure than the rest of your day because of the extra demand on the heart to provide oxygenated blood to the body. It's waking up. You have lots of muscles that weren't being used overnight. You have lots of brain that was not being used overnight. Everything was calm and relaxed and not being used. Therefore, you wake up, the body says, oh, it's time to function. All my muscles need to get better blood flow. I have lots and lots of stuff to do, so the blood pressure begins to rise. It rises rather quickly. First thing in the morning is not usually when I recommend. I usually recommend later in the day. If you wake at 6, you can check at 10-ish. That's fine. It just doesn't need to be usually the first hour or two upon awakening, because it's always going to be higher then than later in the day. Well, I say always. There's always an exception to the always. So generally, the biggest population has higher blood pressure early. You don't want to walk in from work and say, oh, let me check my blood pressure. It's 5:30 and there's meals to be cooked and dishes to be done and kids to get homework and kids to get to ball. Like, you don't want to check it in the midst of that. Okay. You want to check blood pressure when you're relaxed and calm. So it may be closer to bedtime after you've had a chance to, wind down and relax a little bit. It is not the same with glucose, Wanda. I have an article on my blog, joyfulhearthousecalls.com, that talks about checking glucose. Fasting is okay to check, but it is not always indicative of true glucose metabolism because of DOM phenomenon. So typically we prefer you to check before and after meals. That's a better indicator. And the article on my website talks about checking your glucose. So you can type in the search word glucose, and you'll have 2 or 3 articles that'll pop up for you. Read those. But glucose is better checked before and about an hour and a half to 2 hours after your meal. But that article will help you with that. So glucose is better checked before and after meals. Blood pressure is better checked away from early awakening. Okay. Good questions, y'all. All right. Y'all have a great day. Go check out my new article and my new YouTube video. Post them and share them everywhere. Help teach people better stuff about their health. If you have questions, if you have a topic for a discussion, shoot me a message and let me know. I'm hoping to get a couple of special guests to some of my upcoming Facebook Lives. We might do them YouTube and just post them during our live video, because I kind of want to keep them, not just as a Facebook Live. So we might do them as YouTubes, but we're in discussion about that. So, but if you have a topic you want us to discuss, let me know. I'll do what I can to help teach you some more. In the meantime, check out my blog, joyfulhearthousecalls.com, my Facebook page you're at. But please make sure you're following and you like stuff. I will tell you, Facebook algorithms don't count your likes when they're calculating how you get your feed. They use hearts and all the other emojis. They mostly ignore the likes. That's very far down in the algorithm. So if you just like something, you're going to see less of it than if you heart something or care something or whatever the other ones are. Like, use your hearts when you're wanting to continue interacting with that person, whether it's me or someone else. Hearts are high up in the algorithm. And then check out my blog, check out my YouTube video. If you are a patient and need an appointment, you can call us at 402-804-4722, and Linda will hook you up, or you can email joyfulheart4722@gmail.com. The heart is always one. Heart, Joyful Heart is just one. I have lots of people that will post, check out Joyful Hearts. And I'm like, no, I'm not hearts. I only have one. So I do try to impact your heart, but you only have one too. So it's joyfulhearthousecalls.com or joyfulheart4722@gmail.com. So let me know how I can help, and y'all have a great, terrific October day.